My name is Linda. I was diagnosed with a non-Hodgkin lymphoma, and the haematologist offered me a treatment option called watch and wait. The haematologist explained watch and wait to me as a treatment option where they monitor you, look at your symptoms, and as they develop over time, they will decide when is the best time to start treatment.
My name is Robert Marcus. I'm a consultant haematologist and I have a special interest in lymphoma. Watch and wait is an appropriate option for patients with low-grade, slow-growing, unaggressive lymphoma without symptoms who can be observed without therapy and yet can still be offered effective treatment when they require it.
I thought it was a bit strange because I imagined you would need to treat cancer immediately.
It's often very difficult for patients to be told they've got cancer and yet you're not going to treat it. But we need to emphasise that there is no advantage in treating a patient with no symptoms, and conversely there's no disadvantage in waiting 2, 3 or even 5 years before treatment is given, because the treatment will be as effective given then as at the time of diagnosis. The advantages of watch and wait are that patients aren't having therapy, so they're not having treatment with side effects and toxicity, they're not having frequent hospital visits. Patients should know though that they'll be carefully monitored and they will receive treatment when they require it. Patients on a watch and wait policy will live as long as those patients who have immediate therapy for this kind of low-grade lymphoma. Monitoring of patients on a watch and wait programme will involve regular clinical assessment, blood tests, and may involve some scans.
My experience with watch and wait was fairly simple, a blood test every 2 to 3 months and a consultation with a haematologist. She would look at the results with me and monitor to see if there's any other symptoms occurring, and that whole process lasted for me 2 years and 2 months. The main difficulty I found with watch and wait was just not knowing when the waiting would be over and treatment would begin. So to take my mind off that, I just went along to the normal things that I enjoyed. For me is going to art classes or painting and drawing at home, just anything that would make me feel relaxed.
We would start patients on treatment who'd been previously on a watch and wait policy if they had symptoms of lymphoma. So they start to get sweats, fevers or weight loss, or the lymph glands start to compress something important. So the patients start to get difficulty with swallowing, cough or shortness of breath, abdominal swelling, or if on a scan we found the kidneys were being obstructed by the lymphoma.
The watch and wait period ended when I noticed my symptoms getting worse. I had heavier nosebleeds and dizziness, and that all came quite rapidly. So the chemotherapy was what I had as a treatment.
It's very important for patients to be able to talk to the doctor and the clinical nurse specialists about watch and wait. If patients are finding it difficult to cope with the idea of watch and wait, they can always discuss this with a clinical nurse specialist, their doctor at the clinic visits, join a support group, or talk to other patients in a similar position, and I hope that will be helpful for them.
The watch and wait process seems like a good idea because when you're feeling well and not needing the treatment at the start of your diagnosis, you can lead a normal life up until the point where you're feeling unwell, and then the treatment will begin. For other people who are about to start watch and wait, I would say don't worry at the beginning because you're feeling well, you probably don't have any or very few symptoms, but at the same time don't forget to let your doctors know if you notice anything developing, any symptoms worsening, and together with them they will decide with you when is the best time to start treatment.